Welcome back, everyone. Today we have Dr. Matthew Witmer from the Retinal Consultants of Arizona going to answer some questions for us. This time, not a specific topic, we have some questions through social media from some viewers and stuff. Are you ready for some questions?
Yeah, excellent.
Okay, well, here's one.
Good.
Here's one from Debbie. She says she's had a retinal detachment 2 times in her right eye. The first time she had a gas bubble. She had to keep her face down for many weeks. Oh, that just sounds horrible. The second time, the doctor put silicone oil in her eye. The oil is still in. It's been 7.5 years. Is that unusual? And she says her doctor does not want to remove it because she might lose more of the retina. What's your opinion on that?
Yeah, so there's different ways when we fix retinal detachments. Usually the choice comes down to putting gas or oil into the eye. And it's not unusual to have oil left in the eye for an extended period of time, sometimes even multiple years. So it's not totally unusual that she's had it for 7.5 years. I have a feeling that the doctor that's taking care of her likely is thinking that if they take the oil out, that the retina may redetach, and that she'd have to. So the oil is one way to keep the retina attached and to enable her to have the best possible vision at that time. So I think that's probably, but it would be a good idea to have a discussion with her physician about whether or not the oil needs to come out, because at times if the oil's been in there an extended period of time, it can cause some sorts of problems. So that would be a good discussion to have.
Maybe get a second opinion?
Exactly.
Okay. Here's a question from Robert. What can I do if I have already lost some vision from diabetic retinopathy? What are new research or treatment for that?
Yeah, so there's a lot of new medicines actually that are even FDA approved for diabetic retinopathy. So it would depend on what's causing the loss of vision in terms of the diabetes. But it's a good idea to be seen by their physician. The patient would want to be seen by their physician to see if there's different treatments such as laser or surgery or new medications. There's a lot of research into diabetic retinopathy in terms of different medications that we're trying, whether they be injected directly into the eye or be given orally or through injection into the skin. So there's a lot of new options. So it'd be a good idea to consult with a physician.
Yeah, maybe it's been many years. You should.
Follow
Things
up
change.
with doctor.
Okay. Gary says he's had a retinal detachment some years ago that was mended with a buckle. Now his vision is blurry, sometimes good, but he also has allergies. What do you think causes the blurriness?
Okay. So when you have a retinal detachment, there's different ways that the retina specialist will use to try to fix retinal detachment. One of them involves a scleral buckle, which is we wrap a band of silicone around the eye in order to fix the retina, to reattach it. If you're having problems with your vision after a scleral buckle surgery, you'd want to see your doctor to make sure that the retina has remained attached. If it's intermittent blurry vision, so sometimes it's good, sometimes it's bad, a lot of times that's related to the surface of the eye, the cornea, so it can be from allergies as the patient, or dryness of the eye. When you have a retina problem, such as a retinal detachment, typically the vision doesn't fluctuate. In other words, it's not better. It's better sometimes, and it's usually, if it's affected by the retina, it's typically usually have poor vision. So I have a feeling in this particular patient that it's a problem with the surface of the eye, the cornea. So I get that reevaluated too.
Okay, from Helen, she says, my left eye is seeing straight lines as wavy. The vision in that eye also tends to have some blind spots coming in and out, like morphing. What's that condition, and what can she do?
So when straight lines are being experienced as blurry by a patient, that's a condition known as metamorphopsia, or also often referred to as distortion of the vision. And there's different conditions that can cause that. So a few of them would be wet macular degeneration can cause straight lines to be blurry, or epiretinal membrane, which is a scar tissue that can grow over the eye. Both of these conditions are treatable by a retina specialist. However, they're treated in different ways. So if it's caused by wet macular degeneration, we do injections of medicine into the eye. If it's caused by an epiretinal membrane, we do surgery to remove the scar tissue that's over the surface of the eye. So I guess the most important thing is to first get a diagnosis.
See a doctor.
See a doctor and make sure you get the right diagnosis, and then you can have the best treatment and have the best visual outcome.
Okay, and the last question from Mary, are women more likely to develop eye diseases. She read that women have a greater chance of developing AMD. What's AMD?
Age-related macular degeneration.
Age-related, okay.
Yeah. So she's absolutely right. Actually, there's been a number of studies that have found women are more likely to have eye diseases. In particular, macular degeneration, but also glaucoma, and also problems with in needing glasses. So she's absolutely right in that regard. It's not really clear why women are a higher risk of macular degeneration. We don't really know. We think it has something to do with the genetics. However, there is some thought that because it is age-related and women live longer, that might be the fact that they live longer also has a higher rate of macular degeneration.
Maybe that's why. Yeah. I don't know. Get your eyes checked, ladies. And finally, we just want to say that Retinal Consultants of Arizona is sending a team to Nepal, I understand, because there's still people suffering there after the last earthquake last month.
Yeah, and actually we've set up a disaster relief fund that you can access if you'd like to donate to the effort to help the people struggling with the earthquake in Nepal. It's on our website at www.retinalconsultantsaz.com. So that'd be a good way if you want to try to help the victims that are suffering so bad. And yeah, we've been fortunate to get involved in trying to help these people that are struggling. Yeah.
That's great. It says they're going to treat patient, help rebuild the medical community infrastructure. Go to the Nepal Disaster Relief Fund button right there on the website. Great. Well, thank you, Dr. Whitmer. Great information.
You're welcome.
We'll see you next time.
Thanks.